And good evening. Welcome to Here's You Get Help right here on WHIG TV. We're so excited tonight to have a special guest with us tonight, Dr. Richard Michal from Rocky Mount Family Medical. Welcome to the show, Dr. Michal.
Thanks, Sandra.
So glad to have you. And I think this is the first time that you have been on with us.
It is.
And hopefully not the last. But Dr. Michal has some exciting information tonight that I have been talking about for about a week, so I know you all have heard about it and are very curious, and we have piqued your interest, so here we are tonight. First of all, Dr. Michal, I would like to talk a little bit about you. Want to do an introduction of you for those of you, now I know many of you know Dr. Michal, but some of you may not. So, Dr. Michal, how long have you been practicing medicine?
Well, I've been in Rocky Mount since 1983.
1983, okay. And you are at the Rocky Mount Family Medical Center.
That's correct.
That's on English Road.
Correct. Mm-hmm.
Okay. Well, you all do a fine job over there because I'm a patient there and I can attest to the great customer service that I get when I go there, so I did want to put that out there. And tonight we want to talk about primarily cholesterol. First of all, it's important, Dr. Michal, to understand before we even get into talking about tests and things like that, it is important to know what cholesterol is. Can you explain what cholesterol is?
Sure. What we'll do is I'll use some little examples along the way, and we'll talk about that. The main thing with cholesterol is that we're trying to assess a person's risk for having a bad outcome. And what are the bad outcomes from cholesterol that you've heard about? Well, heart attacks, strokes. And so what we're trying to do is to assess a person's risk for those things developing in the future. Now, those bad items are happening internally in our body, in the arteries in our heart or the arteries leading up to our brain. And how do you assess that from the outside? Mm-hmm. It's a very difficult thing to do. When these blockages develop over time, it's happening very slowly. When the event happens, that's the bad event, mm-hmm. It can happen very rapidly. But how do you assess a person's risk for those bad things happening? Mm-hmm. Well, we know through various studies looking at various populations of patients that there are certain parameters, certain things we can measure, certain things, lifestyle items, that will predict a higher risk for that patient having that event. One of those items is cholesterol. Cholesterol is in our blood. It's something that we can measure. It is a blood test measure. And one of the things I often tell my patients is that you can have a very, very risky cholesterol right now, and you won't feel that risk whatsoever.
So it's silent until it causes a problem. Is that what you're saying?
That's correct. It is.
Wow. Okay.
Now, one of the things that happens, cholesterol, the bare molecule, is it doesn't like to be around water. And so to carry it through the bloodstream, it has to be enveloped in in kind of a coating, mm-hmm. And that it's carried through the blood. So we call these carrier molecules. Carrier lipoproteins is a big name, but what you can remember is it's kind of like a jelly donut.
Okay.
I use that example to talk to patients. And so you've got this donut, if you will, and it's going through the bloodstream. And, I don't know if you've ever gotten some donuts from your favorite donut shop, but you kind of get miffed a little bit if there's not a lot of jelly in
right.
there. You want to take it back. Well, if you'll think about it just for a moment, that jelly, instead of jelly, that's the cholesterol. And the carrier form is that donut around the outside. Now, we have looked at various risk factors. Remember, we talked about risk factors a moment ago. Cholesterol is one. There are other risk factors: smoking, your age, males, being a male, mm-hmm. is a risk factor. Whether there's heart disease in your family at certain ages. Is it premature heart disease in your family? Diabetes is a tremendous risk factor. And we can go on and name other risk factors. But cholesterol is a recognized risk factor. Well, getting back to this jelly donut model, what I'd like to say is that we measure cholesterol, we can measure it in a classic way. In fact, probably of the viewers, probably over 90, I would say probably 98% of the time, or more, really. When your cholesterol is measured, it's measured using a method that's, I call it the classic cholesterol method. Now, we have various ranges for what brings about a higher risk.
Right.
Using the classic cholesterol methodology. And what we're really doing, we're not really measuring the number of donuts going around in your body. We're measuring the goo or the jelly in the donuts, which in this case is LDL cholesterol. Another way for folks to remember that I try to teach my patients is, you can maybe get confused between good cholesterol, bad cholesterol.
That's good. I'm glad you're addressing that. Please talk about that, because we all do not have an understanding of that sometimes. So please explain that.
Sure. A real easy way to remember, if you write down LDL, remember the first letter is L. A way to remember that is lousy.
Lousy, okay.
Lousy, the
Very
lousy
good.
cholesterol. That's the bad one. You don't want a lot of that one. So that's a way to remember. The L is lousy. There's HDL. H, think about happy or healthy. The good cholesterol.
Okay.
So we can measure those things, and we do that in what's called a cholesterol panel or profile. It's a lab test. Now, we can measure that, and we can gauge your risk and try to treat those numbers to what are more or less accepted standards in the cardiology heart community to alleviate or lessen your risk for a future bad outcome. But remember that that's just one of the risk factors. And I'm going to use another little example here to try to bring this home. Think about driving down the road. You're driving down the road in your car, and all of a sudden the car starts doing something funny. And you think, well, maybe I have a flat tire, it's getting flat. So you get out of your car and you go around and you check those front tires, and they look good. They look good. So what do? Get back in the car and drive off again? Well, what did we forget to do? We forgot to look at the rear tires. So we only got a partial analysis or appraisal of our situation with our car that didn't seem to be doing right. So there's now, in the past few years, there is available to us a way to, if you, so to speak, use my example, look at the back tires of risk for future bad outcomes. And that way, that methodology, is using a test called the NMR lipo profile. I refer to it as a fancy cholesterol test.
Right.
Now, you might think, well, if it's fancy, it involves other major things, and what do I have to do to get that, and so forth. Well, it's just simply using the same blood specimen that we utilize for the classic cholesterol
It's
method.
the same one prick.
Yeah,
It's the same one prick.
Exactly. No extra needles. But we utilize and send it off to a highly sophisticated laboratory where they have very sophisticated methodology.
Right.
And so what we're looking at, going back to my example again of those jelly donuts, it would be easy if we always knew the exact amount of jelly that was in those donuts. But we don't.
We don't.
Some donuts have a lot of jelly, some donuts have very little jelly. We know that the amount of jelly present, we can measure that, but we don't know about the number of donuts. Now, if I convert that into the terminology scientifically we use, we talk about LDL cholesterol. Remember, that was the L, the bad, the lousy cholesterol. We can measure that. That's in the classic method. But then we can, using this new method, we can measure the number of particles, if you will, the number of donuts. Why is that important? Well, we have found through studies that the number of particles is also related to risk.
Okay.
And we can't judge the number of particles based on some sort of ratio given knowing what the classic cholesterol is. And unfortunately, what happens a lot of times, more than you'd think, 40%, in some cases over 40% of the time, you can't predict that. And so someone may end up having a cholesterol that on the surface, the classic method looks adequate. It doesn't look alarming. We may do very little to manage that. We may think, well, you look good. Well, it's kind of like checking those two front tires. We haven't looked at the back two. Doing the particle number, we find out there is excess risk. In fact, it's sad to say this, but do you know that upwards of close to 50% of heart attacks may occur when there is a normal cholesterol?
Yeah, I can't believe that. We were discussing that earlier, and that is just unbelievable. Your cholesterol's fine, and all of a sudden you have a heart attack. Wow.
And what we, what we've learned is, it may be a risk factor that was not optimally controlled. People sometimes, in spite of what we say, will continue to smoke, for instance.
Right.
Or they may have diabetes, and their diabetes is maybe not quite managed, or their blood pressure is a little bit off. All of these things can contribute to excess risk. But even in optimal conditions, what we're learning now is that the particle number was out of line. And if we had known that, possibly we could manage to that and maybe decrease the number of heart attacks and strokes.
Wow. Well, Dr. Michal, this sounds wonderful. Is this test, does it cost more than the normal cholesterol test? Is it $200 or $300?
No, fortunately, it's not that expensive. It's going to cost about double what the classic cholesterol test runs. But clearly, most insurances pay for this. Even Medicare, which sometimes is kind of a laggard in paying for things, even Medicare will cover this test. Generally, what we're talking about is under $100 for that fancy test.
To save lives. Yeah, because a regular cholesterol test, I believe, is $40, $45. So you're looking at $80 or $90. I mean,
true.
to really to save lives. And I'm glad to hear that Medicare will pay for it. You said that they will pay for it. It looks like people are anxious to call tonight, so I'm going to interrupt, which I wanted to get the message out first, but I'm going to see if we have a good question here. Oops, I think it's been ringing for a while, so I apologize, but we're trying to get the information out. So, Dr. Michal, is it fair to say that it is management for those people who do have a problem, heart problem?
Yes. Now, for folks that already have a diagnosed heart condition, you have some blockages, perhaps you've had a previous heart attack, or perhaps you didn't have a heart attack, but you had a bypass before that happened, or the stent procedures. It's very, very critical to make sure that your risk factors are managed very carefully. In fact, I know as patients this is a tough concept to understand, but I'm sure that in the back rooms everybody compares their cholesterol numbers and well, mine is this, what's yours? And you might find that, well, how come your doctor got all concerned about your number and yet mine didn't get concerned about mine? And this is the concept that we try to take everything in the context of that patient. What I mean by that is, does this patient have risk factors? Do they smoke? Do they have blood pressure issues? Are they a diabetic? so forth and so on. We have to analyze all that, try to put that patient, assess what their risk is. Is it very high,
Right.
low, medium? There, we put them in that, we try to categorize them and then analyze and interpret their values. So a value for one patient may be okay, whereas another person, we have to manage it much more tightly because of previous
Right.
heart disease, for instance.
What about someone who does not have a heart problem? Is this a good test for them for prevention purposes?
Well, yes, it is. It is. Because, you know, most folks that come to us, especially when they think they're doing okay,
Right.
you know, folks nowadays want to be pretty aggressive. You know, one of the areas that I found this test to be incredibly helpful is if I'm talking with someone who appears to be healthy. I mean, they have no risk factors, they don't smoke, they exercise, they're doing the right things. And their classic cholesterol may look quite good, but I get from their family history that there's a tremendous family history of heart disease. And so I look at that situation and I talk to them and I say, you know, the classic cholesterol pattern looks good, but I'm concerned that, you know, people on one side of the family they're having significant heart events. And I'd like to do this other test that will assess your risk in a different way. And it's amazing how many of these folks end up having problems with their particle numbers, and we wouldn't have caught that doing the classic one.
Wow. Wow, how wonderful. Okay. Well, we're going to take a break right here on Here's You Good Health. We'll be right back with some more information. And our guest tonight, Dr. Richard Michal, Rocky Mount Family Medical. We'll be right back.
A better life for you guaranteed. With over 40 years in healthcare, Home Healthcare Supplies can help you be as active as you feel. We carry a large selection of mobility aids to help you achieve the level of freedom and independence you deserve. We have scooters, hospital beds, power and manual wheelchairs, and bathroom safety products available to make your life easier. We can help with diabetes management and therapeutic footwear, post-mastectomy bras and breast forms, and erectile dysfunction with immediate results without surgery or drugs. Do you suffer from arthritis, back pain, joint pain, wounds, or cramps? Home Healthcare Supplies offers pain relief without drugs. If you have neuropathy or poor circulation in your arms or legs, you may want to try anodyne therapy. We have the best trained staff in the area. We are bonded, certified, and licensed. Stop by and see what a difference we can make for you. We accept all major insurance, including Medicare and Medicaid. Home Healthcare Supplies, Hampton Shopping Center, Winstead and Hunter Hill Road.
Come see us at Home Healthcare Supply.
The right orthopedic care can make a big difference in terms of maintaining or recapturing your quality of life.
When you come to my office, you will see me, not my assistant. When you come to our waiting room, you normally do not have to wait long. Most often you do not need a referral, and if you do, we will help you with it and we'll tell you so. If you need an appointment, we will try to get you in today or tomorrow, so we can help you when you have pain and not 3 weeks later.
You don't have to live with the pain of carpal tunnel, and you don't have to go out of town to have the latest procedure done. Dr. Bloom can take care of it with a simple incision. Relieve the pain of carpal tunnel now. Make Dr. Bloom your family's orthopedic doctor. Call Dr. Bloom at 252-937-2663.
Hi, I'm Jean Almond. I want to invite you to bring your prescriptions to Almond's Drugstore. It seems like at those big name pharmacies, they only care about filling your prescriptions and pushing you out the door. At Almond's, we'll call you by name and treat you like family. Our pharmacists are accurate, trustworthy, and eager to talk with you about all your healthcare concerns. Our cash prices are lower than most, and we'll accept your insurance. Call Almonds now and we'll transfer your prescriptions. That's all it takes to begin being called by name and treated like family.
Want great eye care? Interested in contacts? Family Eye Care Center is for you and your family. After your eye test, our optician will help you select the style, shape, and color of eyeglasses that are right for your eyes. If you want to try contacts, there are many different options: extended wear, disposable, even bifocal lenses. Your vision is our only concern, and we have the latest in advanced eye care technology to assist us. Our Rocky Mount office is located at Joyner Crossing Shopping Center across from Jack's Grocery on Highway 97. Call 252-985-3937 for an appointment today, and visit us at FamilyEyeCareCenterNC.com. Most insurance plans are accepted at the Family Eye Care Center. Come in now and get 50% off a second pair of eyeglasses. Whether you're looking for sunglasses, designer eyewear, or comfortable contact lenses, Family Eye Care Center will help you find the perfect solution.
Okay, and welcome back to Here's Your Good Health this evening, this Wednesday evening. Thank you for joining us, and our guest tonight, Dr. Richard Michal, Rocky Mount Family Medical. Thank you so much again for being here.
Thank you.
Wonderful information. Dr. Michal, what are some things we can do to lower our cholesterol?
Oh, that's a great question. You know, let me not talk about medicine right now, because there's a lot of things that have nothing to do with medication. And this is something that all of us can do. Even if you don't know what your cholesterol level is, although I highly advise it, there are many, many things. And we call these lifestyle change things. Mm-hmm. One of the most important things, and my patients know that I always talk about this, is just exercise, walking. You know, most of us can walk. Now, sometimes we're limited because of orthopedic issues, problems with our joints and so forth. But just walking is a wonderful way to manage cholesterol. Remember, we talked about the healthy cholesterol. Now, remember which one that one? It's HDL, the healthy cholesterol. We can actually raise our good cholesterol values by just walking. We can lower our bad cholesterol. Remember which one that was? The LDL cholesterol, the lousy cholesterol. We can lower those by just walking. And you know, I think one of the great things about Rocky Mount that I've seen over the years is the development of great facilities. You know, we've got wonderful facilities here in town. You know, it's difficult to exercise for a lot of us when it's 90 degrees out, right, or it's 25 degrees out. But there are wonderful indoor facilities available. So you know, we have a sheet, we have a handout that we have a lot of those with contact numbers and some information. I would just encourage somebody to look into that, because it's wonderful. You know, when you're living out in the country, it could be dangerous walking on the side of the road.
Right, absolutely.
So we don't want to do that, but I encourage people with long driveways. You know, if you live in the country and you have a nice long driveway, walk up and down on the driveway. It's safe there. You know, what we're shooting for is about 20 to 30 minutes. Now, 20 minutes will burn some sugar, 30 minutes will burn some fat. So it's your choice which way you want to go. But it's important to do it at least for about that period of time, and I would encourage folks to probably do this 4 to 5 times a week. Remember, this is perhaps an alternative to taking a medication. Now, by raising of hands out there, how many people take medicine just once a week? Very few. There are very few medications that are designed to be once a week medicines. So if you want to do this to help your risk factors, you really have to believe that it's something to do on a regular basis. So walking is a great thing to do. For people that are challenged, look at biking, look at exercise biking. There's lots of alternatives, and if you talk with your physician about that, you know, you can probably come to agreement on some things that will work for you. So that's just exercise. You know, obviously our diets play a role as well.
Yes.
Now, now that we're clear from Christmas and the holidays, we can talk about diets a little bit better. Honestly, it works against us. You know, people are eating out more. you know, many of the things that we eat out are not the best
Absolutely.
for us. The quick and easy things are sometimes not the best for us. You know, I talk to patients about portion sizes. That's very important. And then we talk about low-fat diets. There's a wealth of information out there. Some of you have heard about the Mediterranean diet, cooking with different types of oils. Using how we cook is very important. Now, believe me, I don't cook very much, but my wife cooks very carefully with how she cooks, and so grilling things instead of frying. You know, take those things, and you'd be amazed. I know some of the women are really scared about doing this because they think, you know, their spouse may not like this healthy cooking, but you'd be amazed. You know, you can slip these things in and start changing things around, and you'd be surprised at how people can eat healthier just by making some modifications. So these things are very, very important. You know, there are certain things that people have probably read about. You know, oh, I read about Cheerios, it reduces cholesterol. Well, it may do it about 3%.
Yeah, I was going to say, you better eat a lot of Cheerios. You better not be diabetic while you're eating them.
That's right. So, you know, there are certain things that you can do, certain things, again, that are non-medication. Then we get into the whole realm of medicines, and, you know, that's probably another subject right there. And there are many, many medicines that we can choose that can lower cholesterol as well.
Well, I have a question. You're talking about the HDL being your good cholesterol. Why is cholesterol good?
Well, that's a very interesting question. We know that folks who even have a low level of the bad cholesterol could end up having a higher rate of heart attacks. And they looked at those folks because it was a very big puzzle.
Right.
Why would somebody with a low LDL, the bad cholesterol, why would they go on to have a heart attack? I thought that was a good thing. Well, they found out that these people also had low good cholesterol values. And so that can equally predict future risk of bad outcomes. So the good cholesterol, and, you know, honestly, in terms of what happens on the cellular level, the microscopic level, we're still trying to kind of find all this out scientifically. But the long and the short of it is, we believe that one of the ways that the good cholesterol protects us from these bad outcomes is that it actually latches onto the bad cholesterol and pulls it out of the circulation.
Okay.
And it brings it back to the liver, where it's, in a sense, taken out of the system.
Right.
You know, cholesterol is only bad when it lays up next to the artery, the inside of our arteries. So that's where it does kind of the damage, is there. So if we can take it out of circulation, so to speak, then we think that that's one way in which it lowers the risk of heart attacks.
Well, thank you for
So
that answer. That's interesting.
You'd like to have a lot of those guys on your team, you know?
Absolutely, yeah. Well, we need to work on our HDL then, our healthy cholesterol. Okay, I'm going to invite you to call now, 407-1111. Dr. Michael's got out a lot of information. We're still going to talk, but I do invite you to call while we're talking, and we'll take your call. For any questions you have, please, pertaining to cholesterol tonight. We'll invite Dr. Michael back maybe to talk about diabetes and some other subjects at another time. But tonight we're talking about this wonderful test. And this test, Dr. Michael, how long has it been on the market, so to speak? I know it's been in research probably for years.
Sure. And you know, that's the way it happens, is they'll have research tests available at a research level. And when it becomes clinically relevant, it looks like it's a tool that the vast majority of physicians could utilize with their patients, then there's a drive to get it available on a commercial level, where practicing physicians, even at local practices, can utilize this test. So it's been available commercially for us for several years now, and in the past 4 to 5 or 6 years, I've been starting to utilize this test with our patients.
Wonderful. And so if you are interested in this test, you can certainly call Rocky Mount Family Medical and make an appointment. They are, I believe, taking new patients. And what is your phone number, Dr. Michael? There it is right there, 443-3133. Thank you to our board technician. Very good job. But you may call there, you may make an appointment, and they certainly are doing those tests right there at Rocky Mount Family Medical Center. So this test is, research is wonderful, and we never know what they're working on next. But when something like this comes out and you explain it the way you do, we know that it can do nothing but just help us prevent bad things happening. And it's so important. Talk to this a little bit, Dr. Michael, how important it is to have regular checkups.
Well, yes, it is. You know, part of us being able to tell a patient what their potential risk is for certain outcomes means we have to see you. You know, we have to see you. And, you know, doing the screening tests, for instance, for the cholesterol, for diabetes, it just means getting a simple blood draw.
Right.
You know, for a blood pressure, I mean, it's a very simple test to do. It carries a lot of weight in terms of whether you're at excess risk for a stroke or a heart attack. So these things are very, very important. And, you know, if we lived in a time and a day in a culture where these things were very rare, then you could say, well, I'll take my chances. But unfortunately, we have an epidemic of diabetes in this country. The area that we live in is rampant with diabetes, with blood pressure, with cholesterol. Physicians from around the country, it's very interesting that in certain parts of the country, these things are much more rare. But in a simple, regular day, I'll see 10 or more patients that have diabetes, blood pressure, cholesterol. I mean, literally, sometimes it's dozens in a day. Right. So, you know, it's something that unfortunately is very common, but if you don't get it measured, you won't know.
Well, anything is, just about anything is treatable. Is that not correct? If caught in time. I mean, if you just catch it, cancer, whatever, isn't it so much more treatable if caught in time?
As I tell patients, I'd much rather treat proactively before you have your heart attack than after you have your heart attack. Obviously, you know, it just makes a lot of sense in this regard that prevention really is worth a pound of cure.
That's what they say. Okay, we're going to take our final break here on Here's Your Good Health, and we'll be right back after these messages.
A better life for you guaranteed. With over 40 years in healthcare, Home Healthcare Supplies can help you be as active as you feel. We carry a large selection of mobility aids to help you achieve the level of freedom and independence you deserve. We have scooters, hospital beds, power and manual wheelchairs, and bathroom safety products available to make your life easier. We can help with diabetes management and therapeutic footwear, post-mastectomy bras and breast forms, and erectile dysfunction with immediate results without surgery or drugs. Do you suffer from arthritis, back pain, joint pain, wounds, or cramps? Home Healthcare Supplies offers pain relief without drugs. If you have neuropathy or poor circulation in your arms or legs, you may want to try anodyne therapy. We have the best trained staff in the area. We are bonded, certified, and licensed. Stop by and see what a difference we can make for you. We accept all major insurance, including Medicare and Medicaid. Home Healthcare Supplies, Hampton Shopping Center, Winstead and Hunter Hill Road.
Come see us at Home Healthcare Supply.
The right orthopedic care can make a big difference in terms of maintaining or recapturing your quality of life.
When you come to my office, you will see me, not my assistant. When you come to our waiting room, you normally do not have to wait long. Most often you do not need a referral, and if you do, we will help you with it and we'll tell you so. If you need an appointment, we will try to get you in today or tomorrow, so we can help you when you have pain and not 3 weeks later.
You don't have to live with the pain of carpal tunnel, and you don't have to go out of town to have the latest procedure done. Dr. Bloom can take care of it with a simple incision. Relieve the pain of carpal tunnel now. Make Dr. Bloom your family's orthopedic doctor. Call Dr. Bloom at 252-937-2663.
Hi, I'm Jean Almond. I want to invite you to bring your prescriptions to Almond's Drugstore. It seems like at those big name pharmacies, they only care about filling your prescriptions and pushing you out the door. At Almond's, we'll call you by name and treat you like family. Our pharmacists are accurate, trustworthy, and eager to talk with you about all your healthcare concerns. Our cash prices are lower than most, and we'll accept your insurance. Call Almonds now and we'll transfer your prescriptions. That's all it takes to begin being called by name and treated like family.
Want great eye care? Interested in contacts? Family Eye Care Center is for you and your family. After your eye test, our optician will help you select the style, shape, and color of eyeglasses that are right for your eyes. If you want to try contacts, there are many different options: extended wear, disposable, even bifocal lenses. Your vision is our only concern, and we have the latest in advanced eye care technology to assist us. Our Rocky Mount office is located at Joyner Crossing Shopping Center across from Jack's Grocery on Highway 97. Call 252-985-3937 for an appointment today, and visit us at FamilyEyeCareCenterNC.com. Most insurance plans are accepted at the Family Eye Care Center. Come in now and get 50% off a second pair of eyeglasses. Whether you're looking for sunglasses, designer eyewear, or comfortable contact lenses, Family Eye Care Center will help you find the perfect solution.
And welcome back to Here's to Your Good Health this evening. Again, our guest, Dr. Richard Michal, Rocky Mount Family Medical. We had a call off the air, and I do want to invite you to call 407-1111. You can call right now, and Dr. Michal will try his best to address your question. But we had one off the air. Went ahead and took it, and the question was, Dr. Michal, can cholesterol have anything to do with congestive heart failure?
All right, we'll try to do this as simply as we can.
Okay.
Because it's a complex answer to that question. Congestive heart failure, if you'll think for just a moment, the heart is a pump. It's pumping vital blood, vital oxygen to all the parts of our body. It receives that back and it pumps it out again. Receives it back, pumps it out again. Very complex tool. You know, the pump on your car, if it goes out, well, you may have a problem, but at least you can get that fixed and so forth. The pump on your heart, if that goes out, that's not a good problem to have. Now, the pump can be damaged, if you will, or diminished in its ability to pump, to function properly, for lots of different reasons. There are many, many reasons. Indirectly, one of them can be as a result of poor cholesterol levels. Let me give you an example. You can have a perfectly functioning heart, but if you have one of those bad outcomes, a heart attack, that part of the heart is damaged now. It may not recover fully. When that doesn't recover, part of your pump is no longer functioning well, and you'll have diminished pump function, and that has a host of symptoms, a host of problems associated with it. So in that respect, cholesterol, in a way, led up to possibly that heart attack. So the answer to the question is that many times it can be a cause of heart failure. Heart failure can have other causes as well, but hopefully that answered the question.
Very good, very good. Okay, we're talking about cholesterol tonight. For those of you that are just tuning in, we are talking about a new test. And I want to go back over that for those that might have just tuned in. Go over that just a little bit more. Let's talk a little bit more to the test itself, Dr. Michael.
Well, again, what we're trying to do is to assess your risk as a patient for having future heart attacks and strokes, or to prevent any future events from happening. And the classic cholesterol method, which you get from a blood test, may be only giving us a partial answer. It's certainly important to know that, but as I alluded to previously, it may be only a part of the answer. By utilizing this new methodology, I call it a fancy cholesterol, if you will, and again, it's from the same blood test, the same blood draw. We can now look at what's called the particle number. It's not just the LDL cholesterol itself, but it's how many particles are carrying that. And that is an independent risk factor for leading up to heart attacks and strokes. So we're basically getting a fuller body of information to manage your medical situation.
Now, the particle thing is kind of an intriguing thing to me. Is this something that they're just realizing is important in the risk management? Is the particle thing something that in the past, years ago, we didn't really pay as much attention to?
There's no doubt that we haven't paid as much attention to it. And like many things in medicine, you know, it's hard enough to manage sometimes the basic classic cholesterol, much less have another layer to which we want to treat our patients. So there's no question that it's been an underutilized test, but I believe that as more physicians become aware of it, as patients become aware of it, because it is readily available, your physician here locally, whether at Family Medical Center or at a different practice, can order these tests. I would encourage folks to at least broach that subject with your private doctor.
Absolutely. Talk to them
and talk to them about it a little bit and see whether they think that in your situation it would be helpful. Sometimes we know we're going to treat based on the classic cholesterol alone, and we may not need that fancier test until further down the road when we're trying to determine, do we continue to treat it even lower, or are we at a good, happy point now?
Okay, we have another caller on the line. Good evening.
Yes. What is the average cholesterol numbers?
Very good question.
Oh my. Well, in healthy populations that are taking care of themselves, you know, it's really hard to say that there's an average. You know, average may not be good. You know, I think the best way to look at that, again, goes back to something we talked about earlier, would be what's the context of your situation? Do you smoke? Do you have diabetes? Do you have blood pressure issues? Do you do any kind of exercise on a regular basis? What is your weight? What is your, you know, do you carry a lot of weight around your waist or on your hips? Or these are all risk factors. How old are you? You know, these are all risk factors. We put all those things in the equation, and then we look at your cholesterol number to kind of put it in a better light to know what it should be. So there, you know, in general, we'd say is, if you want to be optimal, you know, one of the things I'll do with my patients is I'll do it like the Olympics. Do you want a bronze medal, silver, or gold? And so, you know, that helps some folks who are just starting to look at it, and we say, well, how aggressively do you want us to optimize your values? You know, it takes a lot of effort to get to a gold medal. Ask any athlete, the training, all that's involved in that. And likewise, when we're trying to manage, whether it be blood pressure or cholesterol that we're talking about this evening, it takes effort. And believe me, you know, your physician, you know, I want to expend the amount of time that you want me to in trying to get you to the best values possible. Some people are just, they're happy with getting to a certain point, and that's fine.
Right.
It's a good question. I hope I answered it in a way that's medically meaningful for you.
Well, let me just pull out the diabetic, Dr. Michal, if you will. Should a diabetic's cholesterol be lower than someone who is not a diabetic?
Great question. And the answer is, unfortunately, we have to hold the diabetic patient to a higher standard.
Right.
So again, what might be an okay value for a non-diabetic, all of a sudden now is not an okay value for a person who has diabetes. And you know, we could talk about that with blood pressure, the same type of thing. I think as a patient it gets very confusing, because you'll hear a number and they say, well, that number is okay, but in these situations it's not okay.
Because you're diabetic, it has to be lower. So, I mean, Dr. Michal did a fine job of explaining that, but is that kind of what you're asking?
Well, no, sometimes you'll hear your doctor say it's 180 or it's over 200. That's what I was getting at.
Oh, okay. Now, what you're, when they may be talking about your total cholesterol.
Oh, yes.
Okay. Here's what I would say about total cholesterol. Although it's easy because it's one number, it can be rather misleading. I'll give you an example. You can have a total cholesterol over 200, maybe 210, 220. And someone might say, well, gee, that doesn't sound too good. I've heard that it should be below 200. Well, remember we went back to the concept of good and bad cholesterol. If you have a lot of the good, healthy cholesterol, that will skew your total. So although we report it on our labs, I almost never really emphasize that, because I don't think that's giving us enough information. So I always like to know what the LDL and the HDL and then also the triglyceride part of that is. So that I think that you kind of need to dig a little deeper with your physician, go over those breakdowns on those other parts of that test.
Okay, thank you so much.
Thank you for calling.
Bye-bye.
Bye-bye. Okay, 407-1111. We've got time for a couple more calls if you'd like to call. And yeah, that's always interesting, because you're right. You do have to know that, and you said that before we went on the air. You have to know the patient.
Exactly.
And all of their factors. Good evening.
Yes. I was dealing with high blood pressure and high cholesterol, and I went on a weight loss diet, and I was able to go off both of my blood pressure medicines, but on the contrary, my cholesterol went up after losing 35 pounds. How do you explain that? Does that mean maybe my cholesterol is purely genetic and that diet has nothing to do with it, or was it just a fluke?
Well, first of all, congratulations. I think it's great, absolutely super that you went through that, because you know that you did a lot of hard work to get to that point. So first of all, congratulations on that, and don't stop doing it in terms of your lifestyle changes. But unfortunately, you know, you bring out a great point, and that is this, that in terms of modifying your lifestyle, you know, we talk about that, and it's very important. Losing weight can dramatically affect diabetics. It can turn poor numbers into very well-controlled numbers. With blood pressure, likewise, weight management, exercise, it's a great way to lower the blood pressure. And oftentimes, with the dramatic response that you had in your weight management, you know, people can come off of those things or dramatically reduce the medicines they were on before. Unfortunately, you're an example of the fact that probably in terms of cholesterol, unfortunately, probably about only 20-30% of that is determined by our environment, our exercise, our diets. probably the majority of cholesterol is determined by our genes. So you did a great job. I'm sure you were commended for that, but unfortunately you're learning the hard case that it is genetically determined. You know, I think about a boss. You know, you can have good bosses and bad bosses, and the bad boss will make you do a whole lot of work when you're thinking, gee, this is tough. You know, we thought we were doing a good job, and they want more from us. Well, in a sense, the gene boss is telling your liver, listen, we want to produce a lot of cholesterol. In fact, this is the level we're going to be happy with. And you better produce it, by the way. So the liver listens and says, okay, I don't think we have any choice here. And you've been trying to limit the raw materials going into that factory, the liver. You've been saying, well, I'll eat better, I'll reduce the things that can create cholesterol. But somehow that liver has listened to the gene boss and said, if we want to have a job, we better do this, and we're going to produce it no matter what. It's a very simplistic way of thinking about it, but in the reality, it's kind of true.
Right. You're exactly right. Okay.
All right. Thank you.
Thank you. Very good questions. We're getting some very good questions tonight. Appreciate all of you calling. We do have time for one more call, so 407-1111 if you want to ask Dr. Michal some questions. But it does boil down to your physician knowing, and we do want to say on this program tonight, we are not here to diagnose anyone. Go to your health care provider. If you do not have a health care provider, Rocky Mount Family Medical will be happy to talk to you, take you in. So, good evening.
Good evening. I'm going to hang up. I just want him to, are there foods out there that can boost the good cholesterol and lower the bad? Are there, like fibers or anything like that? I just wonder if there are types of foods you can eat along with exercise. And I'm just going to hang up and let you elaborate.
Thank you.
Yes. There are different types of foods that definitely will help you with that. They've looked at plant sterols, which is in a lot of products now because they realize that it can help. And, you know, we're talking 10, 15%. So, you know, again, if you get 10 or 15% from here, 5 or 10% from here,
right,
you know, it can add up. So, and those things are readily available and marketed as such for help, to help. So, the fish oils and things of that nature are also across the counter. Niacin is across the counter. It's a vitamin that has a role in cholesterol metabolism as well. So there are different products that are available, and of course the foods.
Right. Very good. Okay, well, I think we've talked a lot tonight about cholesterol. Hopefully, I know you learned something tonight from Dr. Michal. Thank you for your calls. And as always, as we say, we can't diagnose you, but if, as we just said, if you would like to call 443-3133, make an appointment with Rocky Mount Family Medical. They can certainly help you with the test that we talked about tonight or for any other of your health care needs. They are a family practice. And I would like to say, I would proudly like to say that in this community we do have a Christian practice. Dr. Michal, can you speak to that just a little bit?
Oh, gladly to. You know, one of the driving influences behind creating this practice was my desire to honor God and to honor the Lord Jesus through a business and through our practice. And you know, through the years we've tried to do that. Obviously we're not perfect, but our goal is to strive to provide quality care and to really care for the patients as best as we can using Christian principles, and we have a real joy in doing that.
Will you pray with your patients if they so desire?
Absolutely. Absolutely.
Wonderful.
Absolutely. Yes. In fact, today I did several times.
Really?
Yes.
Wonderful.
You know, it's a joy to be able to help folks. You know, sometimes we don't have medicine. Sometimes we don't have a medical answer. and even through all the training that we do. And yet I have found that sharing that time and being able to pray with that patient over that situation is just, it's a blessing. It's a joy to do that. So through the good times and through some of the difficult times, that has made my practice of medicine tremendously meaningful.
Well, I think that's wonderful, and thank you so much for being with us tonight.
Thank you.
Thank you all for watching. That's the end of our show. Stay tuned for Tri-County Spin next. Have a good evening.